Welcome everyone on our channel of podiatric and plastic surgery. Now let's continue our discussion on lymphedema and enter the part 2 of this whole series, in which we are going to talk about certain investigations that we need to do in a patient who presents to us with lymphedema. Now in the first part we discussed what lymphedema was, what are its etiologies, and what are the signs and symptoms. So let's go a little bit more into the details of investigating these patients, and then we'll graduate on to the treatment options that are available. Now to begin with, one thing that needs to be understood is that when a patient presents to us with lymphedema, it's already an outcome of chronic obstruction. It's not something that has happened in the recent past that we'll be able to identify the etiology by doing certain investigations. The obstruction has been present for a period of a year or 2 years, and now it has reached a point where it is clinically evident swelling, and hence we may not be able to identify the cause with the help of investigations, but certain basic histories can help us guide towards finding those etiologies. So there is no real advantage of trying to identify the cause because we may not be able to reach it categorically, and sometimes it is more of a clinical judgment. So histories like operated for oncosurgery with radiotherapy and chemotherapy can be a very clear-cut indicator of the cause for this lymphedema, uh, that is post-surgical, and history of developing fever with lymphadenopathy and then gradually developing edema of the lower limb, inhabitant of an area where it is very common sight. You have other people who are suffering from lymphedema that could indicate towards filariasis. Swelling that was not present at birth or was present at birth but gradually started to appear after the age of 2 could indicate something that is towards a congenital lymphedema. So now moving on to what investigations can we do in a patient who presents to us with lymphedema. Now there are essentially two set of investigations. The first one is biometrics and assessing the volume of the limb. Now there is a lot of research, various methodologies that are available to accurately determine the volume of the limb, because it is the volume of the limb which is going to give a clear indicator as to a response of any form of treatment that has been given. So it is a gold standard measurement of limb size. Now, once we have those investigations, we move on to certain imaging investigations that can help us diagnose, even stage, and can give us an idea of what treatment might be adequate for the patient. So, when a patient comes to our OPD, we go ahead and do certain basic biometric measurements. Now, these include weight and the height of the patient, and hence calculating the BMI. Now, BMI is a significant risk factor for patients to develop lymphedema, and it has been categorically proven as well. So, weight reduction can help relieve lymphedema, at least can eliminate some component of the etiology, particularly in overweight and obese patients. However, if somebody has a BMI within the normal range, advising weight loss may not be really helpful. So, weight loss can be given to certain specific subset of patients who present to us with lymphedema. Now, moving on to volume calculations. Now, like I said before, volume calculation is of utmost importance. The reason being that any future comparison of limb size to determine whether the treatment was effective or not can be judged accurately by noting the difference in the limb volume. Now, when we come to calculating limb volume, there are certain ways of doing it which are gold standard. Some of them are fairly convenient to perform and accurate enough, and some of them are mostly for follow-ups. So water displacement is essentially the gold standard. It's based on Archimedes principle, which a lot of us are familiar with, where there is a large cylinder which is filled with water, and we submerge the limb, the upper limb or the lower limb, completely in that cylinder, and the amount of water that spills over is collected in a separate tub, and that volume is calculated. Now this is extremely accurate, However, there are limitations because it is space occupying. First of all, it may not be hygienic, particularly in patients who do not take good skin care or may have ulcers. It's not even advised to patients who have open wounds, and sometimes it's not easy to submerge the entire limb as well, particularly the proximal part. So although gold standard, it is if possible it should be done, but if it's but all other investigations can be compared to water displacement study. Now, a fairly accurate method of determining the limb volume, which is also convenient, is first calculating the circumference of the limb, and then from those circumferential measurements extrapolating the limb volume. So we start at a bony landmark, which is made in the lower limb be the medial or the lateral malleolus. In the upper limb it can be the styloid process at the wrist, and from there we move at 4 centimeter intervals and take circumferential measurements of the limb. Now, these circumferential measurements are then applied to a formula for truncated cone. Now, truncated cone of an height 4 centimeters with the circumferential measurement of the top of this cone and at the bottom of this cone. So, the limb can be assumed to be actually a stack of these truncated cones, each of 4 centimeters, and we have the circumferential measurements at these intervals. So it is fairly accurate, and there are certain softwares that are available in which we have to just enter these circumferential measurements that we took at 4 centimeters, and it automatically gives us the volume of both the limbs. Also, it gives us the difference and the percentage of the difference between the limb volumes, and this can be a very good, accurate, convenient method of comparing limb volumes between on regular basis in the OPD. Now, finally, there is something known as bioimpedance spectroscopy. Now, it's basically a follow-up study that can be done by a physiotherapist on OPD basis, and this involves placing 2 electrodes in your limb and superficially, and judging the resistance to the flow of current from point A to point B. It gives an indirect indicator to the amount of fluid that is present in the interstitial space. So if there is response to the treatment and the interstitial fluid has gone down, the resistance would increase. So this can be done on a regular basis. Now, certain imaging investigations that we should do in patients of lymphedema. Now, first and foremost, lymphoscintigraphy. It is a technetium scan which is an absolute must in every patient who presents with us in which you suspect lymphedema. Now, it's basically injecting a nano sulfur colloid dye in the first and the fourth web space. Now, this is essentially our protocol, and after injecting the dye, we take images at 15 minutes, 30 minutes, 45 minutes, and 2 hours from the injection. Now, what we judge in each of these images is the ascent of the dye. Ideally, these dyes should be uptaken by your lymphatic tracts and should be visible on imaging and reach up to the draining lymph nodes, which in cases of the upper limb is the axilla and in the lower limb is to the groin. So if there is any form of obstruction, there will be no ascent of the dye, the nodes will not get highlighted. So this is important to diagnose lymphedema. Along with the fact that it's not being taken up by the lymphatics, it's going to get accumulated in your skin and the subcutaneous tissue. So there is something known as the dermal backflow. It will be present diffusely over the skin, and that is a very classical sign of patients having an obstruction in the lymphatic tracts. Now, once you have diagnosed with the help of lymphoscintigraphy, there are certain investigations which can stage it much better. And staging is important because it tells you about the eventual prognosis of the treatment that you can offer to these patients. Now, a very upcoming method of staging is with the help of ICG. ICG is indocyanine green. Now, it's based on near infrared radiation, where again we inject the indocyanine green dye. Now, this is not a nuclear study. It's based on infrared radiation, and this dye is again injected in the first and the fourth web space. We again look for the ascent, we look for dermal backflow, and based on the dermal images that we get from these devices, we can stage them into something linear, which is basically normal linear tracks of lymphatic going towards the axillary or the groin nodes, a splash where there will be patches of dermal backflow accumulation, but there will be some ascent, then moving on to stardust, and then to the most severe form of chronic lymphedema where it will be diffusely present. Now, this can be done intraoperatively to identify the lymphatic tracts and help you even in surgeries like the LVA. Now, after we have staged and diagnosed lymphedema, we need to have certain anatomical investigation, which is basically best provided with the help of an MRI. Now, MRI can also help us stage the disease, but more in a more clinical way, whether the lymphedema is fluid dominant or the lymphedema is more of a fat dominant disease, and this can help us provide patients with available options and also in our own judgment to assess the eventual outcome. So MRI can give you a good idea whether the subcutaneous tissue is filled with more lymph fluid, or it is reached a stage where it has been replaced by adipose tissue. So it's an excellent investigation, but can be done just before the surgery rather than doing on a routine basis. So routinely lymphoscintigraphy should be the first investigation, and then if available we can stage it with the help of ICG, and eventually when we go ahead and plan a surgery, an MRI can be done. Thank you very much on listening to this part 2 of our series on lymphedema. We have discussed investigations, and now we'll move on to physiotherapies, surgical treatment options, and then we'll see some of our results. Thank you very much. Please subscribe to our channel, and we'll try and keep coming up with more and more interesting material. Thank you.